Foodborne illnesses impact 1 in 8 Canadians annually, and up to 44% of its related deaths are caused by communicable pathogens. Norovirus constitutes the highest number of cases and hospitalization each year. Treatment includes hydration therapy and isolation. Outbreaks are common, and they are mostly found in healthcare settings. The mode of transmission include projectile-led aerosol, contaminated surfaces, water or food vectors. Older adults and elderly contribute most to norovirus-related hospitalization and mortalities.
Often what we might see is a presentation of viral gastroenteritis. It's going to be supportive care, hydration, rest, washing your hands, and staying clear of other people. The complications are much more serious. You can get fulminant colitis, you can have significant dehydration from the diarrhea.
As we know, norovirus is extremely contagious. It can be spread by just a few particles. So on the educational side of this, students see practicum placements sometimes being cancelled due to norovirus outbreaks at local residential facilities, and that's when it really hits them that this is the importance of hand washing and wearing our protective equipment to really promote the health of our residents and prevent this from happening.
Over 59% of healthcare workers believe they have inadequate or moderate trainings.
One thing that bothers me is knowing that not everyone complies. So just about everything in the hospital is dirty. Like the charts, the paper charts, they touch the pen, they touch the hand sanitizer pumping. It's hard to comply when you know everyone else isn't.
As a non-profit organization applying for funding from the BC provincial government, we aim to implement a series of behavioral intervention in the Greater Vancouver healthcare settings. Our target population will be healthcare workers with direct patient contacts, such as LPNs, RNs, and care aides. We aim to reduce the cases of norovirus outbreaks, as well as building capacity and awareness in healthcare workers. All three components of our behavioral intervention will take place in Vancouver General Hospital. For our first component, throughout the hospital, we will install indicator soap that provides a visual cue for proper hand washing techniques.
I definitely think that would help having a physical reminder. It'll help make it real for people. It's not just a piece of paper with a statistic on it that says, rates are going up. That's easy enough to understand for most people. But when they can actually visualize and see a tangible measure in front of them, then people are kind of like, oh, yeah, these things actually do exist and they actually do affect hospital patients.
Our second component is broken down into two parts. First, we'll provide online education module for workers. These modules are then complemented with in-person workshops on infection controls.
In the workplace, nurses have the opportunity to join in on in-services and workshops on various infection control techniques such as PPE, hand washing, gloves. This all helps promote compliance with infection control measures, which helps to reduce the total number of outbreaks.
Designated staff members will ensure compliance with regular surveys and checklists. Our program timeline is 1 year with 2 in-person workshops and survey evaluation every 4 months. Checklists are to be completed over time by workers, which will provide information on self-reported infection compliance and other self-evaluations.
Created a checklist of things to do for each shift. We had the presence of team members both on day shift and night shift to check in with people and follow up and make sure that those checklists were being done. And I think that presence of having people on all the different shifts really helped with the compliance with that. And we did see a reduction in the rates of infection.
I think having the infection prevention control IPAC people around kind of watching makes people a little more compliant.
With the additional funding from provincial health authorities, we can continue our intervention beyond 1 year and expand it to other healthcare facilities in BC. The program is considered a success if it increased the current hand washing compliance rate of 70% and reduced the proportion of norovirus outbreaks in hospitals. Private investors such as Lush Cosmetics can also help us promote and produce our indicator soap at lower prices.